The whole idea of starting a new hospital really intrigued me. Around that time, the VA hospital that we have right now was being conceived and built starting back in 2012. I sort of dove headfirst into VA and as what I call a plain old cardiologist. And about 2 days into the job, I was made the chief of cardiology here on an interim basis and then ultimately selected in December of 2014 as the chief of cardiology. So I was given the task of building a cardiology section here. And so over the course of time from 2014 up to the present, we now have a total, including me, 25 providers, about almost equally split between physicians, advanced practice persons, that can include nurse practitioners and PAs. We have subsequently, over those years, have added more services that were never provided prior to 2014, and that includes invasive cardiac procedures, cardiac catheterization, coronary angiography, and placement of coronary stents. We do not do cardiac surgery here at this time. We don't have the space for it, quite frankly, at this time. We have the volume, certainly, but we don't do cardiac surgery. We do the full range of electrophysiology procedures, with the exception of something called the Watchman device, but we do all the other ablation procedures and device implant procedures here. We have really what has become a flagship of the VA, really, flagship program in heart failure, which is a multidisciplinary approach to treating heart failure, which is a huge problem not only in the VA sector, but also in the private sector and around the world for that matter. It's the only form of heart disease that's actually increasing in prevalence. And we have a program here that really has been emulated across the VA because it's tailorable to different sizes of clinics. Ours is a large clinic. We now have the largest and busiest clinic in the entire VA system here in cardiology, and we also that the facility as a whole is the largest in the entire VA system. We see more patients than any other place, really.
I'm a general cardiologist, which means I do a lot of different things in cardiology. I'm the director of the non-invasive program, stress testing and nuclear stress testing on the veterans here. So I help direct that program about half of my day. The other half is in clinic seeing veterans like I did this morning. Stress testing is a common procedure where we put people on a treadmill or we give them a chemical in order to see if they have blocked arteries in their heart or coronary artery disease. If they present with chest pain, for example, we may do a stress test on a patient. If that's abnormal, we would then do a cardiac catheterization to look for blockages to see if we could fix that with perhaps a stent. Common procedures, for example, is echocardiography, which is a simple ultrasound of the heart, and that allows us to look at the valves, the heart function, the tissue around the heart, the function of the heart, the blood flow, and whether there is disease that's affected the heart that way. We also do EKGs, electrocardiography, which is a simple test where leads are placed on the chest to look at the electrical activity of the heart, looking for cardiac rhythm issues, enlargement of the heart, evidence of prior heart attack, that sort of thing. The patient that I just saw in the clinic came into the hospital in November with fever and chills. He had blood cultures obtained and it grew out a certain type of bacteria that comes from the teeth. That bacteria actually infected 2 of his heart valves, and in a bad way, where both of the valves were leaking because of destruction of valve tissue in his heart. So we treated the infection, stabilized him, and then replaced both of his heart valves, the aortic valve and the mitral valve. And then today was his second follow-up visit since that surgery. That was a success. Many of these patients don't survive that sort of infection once it gets into the heart and it involves the heart valves.
I was in the service in late 80s, early 90s. I was an electrician's mate for the nuclear power program. I was stationed here in Orlando, boot camp here, born and raised here. It's all one big role right staying here in Orlando. Originally I was having a hard time breathing. I was fatigued and had some heart issues as far as what I felt was heart issues, with the breathing and everything. So I came here to the emergency room and they put me in the hospital here. I stayed in the hospital. It's where I met Dr. Burke with the cardiology department here. They're on top of everything here as far as I'm concerned. They make sure I have my appointments. I go to my appointments. They follow up with everything they need to follow up with. Prescriptions are here, x-rays are here, everything is here. It's basically a one-stop shop. As far as care-wise goes, my appointments are getting farther and farther apart, so that's nothing but a good sign as far as I'm concerned. I've helped veterans that don't think they deserve to have the benefits that the VA provides, or that they don't want to go through the trouble, and it's worth every minute, every bit of time that you have to get the benefits. The insurance alone is enough. You know, you don't have to have medical insurance. You have medical insurance as well, and they'll take that here as well. But if you don't have the means to have it, then it's provided for you, and it's a good thing that they do here. I'm alive today because of Dr. Burke. He's always going to be one of my top 10 humans. He's done a great service to me, and I think he'll do a great service to other people.
The issue of wait time always comes up. How long am I going to have to wait? You might wait a little bit longer to get seen in the VA. If it's an emergency, obviously you get seen very quickly. You get seen that day, but you'll wait longer actually out in the private sector, according to our data here, to get an appointment in cardiology than you would if you stayed in VA. And more than 90% of our patients choose to stay in VA because they've had bad experiences out in the public sector. They're really a different kind of patient. You have to have a lot of understanding about taking care of veterans. There's no question about it. There's often an overlay of psychiatric illness that certainly plays a role in their overall medical care, and you have to understand that when you're talking to a patient. And that is often not understood well in the private sector. We know, as I tell everybody who wants to work here, we know who we take care of. In a nutshell, we do cardiology better at the VA than the community. While I felt that we delivered good care there, I can tell you that with hard numbers, we show that we do it better in the VA with respect to cardiovascular care.